Good morning, good afternoon. My name is Mona Yacoubian. I'm the director of the Middle East Program here at CSIS. It's my pleasure to welcome all of you to this virtual panel discussion on Syria's transition, rehabilitating Syria's public health sector in a fragile transition. This discussion is the first of what we hope will be many as part of a new initiative of the Middle East Program, diving more deeply into the challenges of stabilization in the Levant, with a particular focus on Syria and Lebanon. We will be having discussions that feature new approaches and tools that are being developed. We're going to look at the emerging role of the Gulf as a funder. And of course, we're going to focus on perspectives from the countries themselves. We're very excited to have the Syrian Minister of Health join us for this live webinar. However, he is delayed, so we're going to reverse things and we're going to start with our panel discussion, and then we will have the minister's remarks at the end of the event. So with that, I'd like to introduce our panelists. You have more detailed bio information for them on the event page. We are delighted to welcome Dr. Bachir Tajaldin. He is the Turkey Country Director of the Syrian American Medical Society, managing a $30 million annual portfolio across 50 health projects in both Syria and Turkey. Diana Reyes is a non-resident fellow with the Syria Project at the Atlantic Council's Middle East Program and a postdoctoral associate in science, technology, and international affairs at Georgetown University's Edmund Walsh School of Foreign Service. Diana's research focuses on the impact of conflict and displacement on population health, with specific interests in global mental health and humanitarian assistance. And we have Lolwa Al-Abdulmalek, who is project and program researcher at the Qatar Fund for Development, working under the Humanitarian Aid Department. She focuses on early recovery projects, building strategic partnerships, and ensuring that the QFFD is able to create sustainable long-term impact. She currently leads portfolios for Syria and Ukraine. So with those introductions, let's dive in and I think start with a laydown of the scope and magnitude of the challenges that Syria faces in its fragile transition with respect to rehabilitating the public health sector, particularly after 14 years of brutal conflict. And with that, I'd like to start with you, Dr. Bachir, if I could, and just tell us from your perspective from the field, and I believe you're joining us from Damascus, correct? If you could tell us about what is the sort of the level of destruction that Syria has witnessed with respect to its public health sector, and in particular, what is it that you and your capacity at SAMS have witnessed over the past many years?
Yeah. Thank you, Mona. Good morning, everyone, and good afternoon. I'd like to thank my colleagues, the panelists, Dr. Diana and Ms. Lolwa, and everyone. If I'm going to speak from Syria right now, I'm in Latakia currently. So Syria witnessed 14 years of conflict, which affected all the sectors, but most importantly, the health sector. Starting from the weaponizing the health services, the health sector, targeting the health facilities. During the 14 years, only in the northern of Syria and the besieged areas, there was more than 600 targets on the health facilities that mainly by the regime and its allies. The old regime, Assad regime, I mean, that caused huge damage to the infrastructure, that pushed the healthcare worker to provide the services in non-health established building in the caves under the ground, small building, which affected the accessibility, affected the quality, the infection control. Regarding the public health, I do think that all of us remember the polio outbreak that happened in October 2013 after the disruption of the routine immunization program as punishment of the Syrian population in some areas when they went out of the control of the Assad regime, then the measles, then the cholera, the outbreak, the COVID outbreak, which was not easy to manage and respond to such outbreaks. So this is the situation for the infrastructure, but also the conflict and the political direction of the old regime also caused torturing, arresting, and fleeing out of the country for many and the majority of the health sector. So looking at the public health, we had and unfortunately, we still have till now the consequences of the conflict. We don't have enough infrastructure capacity. But most importantly, we have very huge gap in the availability of the healthcare worker. This is in the northern part of the country. But after the liberation in December 8, when we had access to the other areas, the neglection of the health sector and the basic services and other governorate like Aleppo, Damascus, Homs, Latakia. Also, they are suffering from the neglection, the corruption, and the lack of services. The sanctions themselves affected also the health system. The sanctions themselves were meant to affect some groups, some persons, but unfortunately, those persons could survive from the sanctions, but the actual effect was on the health sector, lack of equipment, lack of the infrastructure. Sounds like any other NGO took the humanitarian responsibility to respond to the population whenever they could. Our main focus were in the northern parts of Syria, northwest and northeast, where we had access, while in other areas, unfortunately, the NGOs and the humanitarian community had no free access to provide the services. In some areas in Syria, mainly northwest, northeast, the more than 95% of the health services were the responsibilities of the NGOs, while in other areas it was under the government. So that also caused like segmentation in the health system governance that needs to be addressed. So this is in brief the situation during the 14 years, and now we are living the consequences of the 14 years conflict. Thank you.
Thank you, Dr. Bashir. That was a very thorough laydown. Diana, if I could turn to you, because you've been following and tracking the challenges that the Syrian health sector has faced throughout the course of the conflict. And I think Dr. Bashir has already offered quite a few details. But I want to see if we could dive a little bit more deeply with you into the complexity of these challenges, whether it's about the mental health challenges and trauma that the population is enduring. We know, as Dr. Bashir mentioned, that a number of health workers themselves ended up becoming refugees and were forced to leave the country. Could you maybe add a little bit more detail to this picture that Dr. Bashir has painted for us?
Of course. Thank you, Mona, and thank you so much for inviting me to be a part of this critical conversation. And many thanks to Dr. Bashir for that helpful overview of the current dynamics inside Syria. I suppose it would be helpful to just zoom in a little bit on the human impact of this long-running crisis. And as a brief reminder, over 70% of the Syrian population continues to be in need of humanitarian assistance, and health is a major component of that. And that's really being driven primarily by deep and sustained poverty, which limits people's access to care, the ability to purchase medications, and manage their health, including chronic illness, which often is the most expensive to maintain and hardest to access in terms of care. And one statistic I often return to really emphasize this human impact, and I saw myself on the ground when I visited Syria in December at the end of last year, is that life expectancy in Syria has dropped from 72 years of age in 2010 to 60 years by 2017. And who knows how much more it's dropped or if it's changed since then. That's a 12-year drop in less than a decade, and it's a stark reflection of how conflict, neglect, and health system collapse have worn people down. And as Dr. Bachir alluded to, virtually no aspect of Syria's health system has been spared. The health workforce was one of the first to flee, so you pointed that out, Mona. The estimates are that 70% of doctors and nurses have left Syria. That's an old estimate. It's likely even higher. Just thinking about that tier of society was the first to leave in terms of opportunities that arose elsewhere. Most of them were politically persecuted, especially in the early years of the Syrian situation. And also their ability to integrate in other contexts is much more likely. So there's a significant displacement of the health workforce, and I'm curious to hear from the Minister of Health, who we'll hopefully hear from later, about plans to sort of incentivize this workforce to come back, which is one of the key aspects of the health system. Dr. Bachir mentioned hospitals and clinics that have been deliberately attacked. The statistic from the WHO is that 40% of hospitals and a third of primary care centers are only partially functioning outside of Syria, across Syria. And service delivery is strained, and especially in rural and underserved areas. So this is in camps or towns with damaged infrastructure. This is where we've seen waterborne disease outbreaks, landmine injuries from unexploded ordnances, and critical gaps in maternal, mental, and non-communicable disease care. So as a sort of, it's a bleak situation that needs addressing at every sort of level. There's no part of the health system that hasn't been spared in terms of the effects of the conflict. And as you mentioned, Mona, as well, thinking about people and how they have endured such suffering over time, there has been a significant mental health impact. And I think the prevalence is about half of Syrians, whether diagnosed or not, have symptoms related to a mental health condition. And there's stigma, of course, in the Syrian society that prevents people from seeking care that they need. But we'll talk about some of the best practices later. But I think seeing mental health care integrated more readily into primary care services, which are where I think the government needs to invest most of its resources now in the current transition period, will hopefully help target some of those needs as they're arising. I did want to make one last plug for some of the work that we've been doing with colleagues, be it at the Johns Hopkins University, where I was affiliated, the Syria Public Health Network, as well as colleagues at Physicians for Human Rights. We've been doing lots of research on the impacts of the conflict on the health system from various aspects, and particularly the displaced health workforce. I've included hopefully it's included in the comment box in YouTube, some of the links to some of the research that we've put out looking at the displaced healthcare workforce and the challenges of them integrating in their respective contexts, and hopefully ways to sort of incentivize them to come back. I'll end with this, that a World Bank report in 2017, which was titled "The Toll of War," looked at the economic impacts of the crisis, has noted that more people may have died in Syria from the collapse of the health system than the direct violence that they experience. So hopefully that gives us a good foundation for why investing in health is so critical at this stage.
Thank you so much, Diana. You paint a very stark picture. And I think in particular, the statistic about the drop in life expectancy, which I had not heard before, is very, very telling. So it's clear, I think, the magnitude of the challenges that Syria faces. We will absolutely, as the conversation evolves, look toward creative solutions and a path forward. But before we do that, Lolwa, I'd like to turn to you, and I know you're joining us from Doha, and the Qatari government has played an important role in providing humanitarian assistance to Syria throughout the course of the conflict. Could you give us a few more details on the role that Qatar has played and your organization in particular with respect to providing humanitarian assistance to Syria, to opposition-held areas in particular, during and throughout the conflict.
Sure. Hello, everyone. This is Lolwa Al-Abdulmalek. Thank you, Mona, for the invitation. Thank you, Dr. Bashir and Diana, for your significant remarks. It's an honor to represent Qatar Fund for Development and discuss Qatar contributions to rebuilding Syria's public health sector. As Dr. Bashir mentioned, 70% of Syrians' health workforce left the country, leaving some areas with one doctor per 10,000 injured or people in need. The collapse of health infrastructure has led to rising communicable diseases, reduced vaccination rates, and untreated chronic illness. Rebuilding this sector requires more than physical infrastructure. It demands strategic investment in human capital, training, equipping, and retaining medical professionals. Qatar plays a key role in global development and humanitarian efforts, actively supporting countries facing conflict, natural diseases, and disasters, and economic hardship. At Q50, we are committed to delivering integrated, efficient, and sustainable aid, especially in fragile and conflict-affected areas. Q50 has led the Quest initiative in Syria, which initially focused on education and youth empowerment, and then expanded to include the health services, offering reproductive health and nutrition, primary, secondary, and tertiary care to over 6 million Syrians. Also, Q50, together with Qatar Charity, operated 6 health facilities and supported 3 hospitals across northern Syria, including bolstering the ambulance system and establishing medical warehouses during the COVID-19 pandemic. Following the recent political shifts, Qatar have launched an air bridge of 12 aircraft delivering medical, food, and shelter aid. We have supported a series of completed, ongoing, and upcoming health projects with emphasis on underserved area where health access remain severely limited. Before, we used to support project in northwest Syria. Today, we are expanding and exploring projects in the newly accessible areas. Our current priorities include continued support to Bab al-Hawa Hospital in Idlib, and also Q50 maintains strategic health support for Syrian refugees in Jordan. We have been supporting Al-Za'atari camp since 2019. Today, we are supporting Al-Za'atari and Al-Azraq camp, covering approximately 70% of the health clinics in the camp, in Al-Za'atari camp, in partnership with IRC, QRC, QC. Through several initiatives, Q50 continues to deliver principled and impactful support. We remain steadfast in our commitments to help Syria's health system and ensure access to care to the most vulnerable people. Thank you so much.
Thank you, Lolwa. Thank you for that very helpful description of the work that Qatar is doing in Syria and the role it has played prior. I want to dive now a bit more deeply into kind of where Lolwa has taken us, which is current activities and what are the challenges, what are some of the more innovative and creative solutions. I also want to remind our audience, I realize I forgot to do that at the beginning, that we welcome your questions and comments. You can pose them either in the YouTube comments box, or I believe there's a questions box on the CSIS event page. So we do certainly want to get folks' questions and comments into the discussion. But Dr. Bashir, if I could turn to you and just ask if you could lay down in more detail the kinds of work that SAMS is involved in. And I think you highlighted in your initial remarks the importance of NGOs because of just how significant the challenge is in Syria. I think what would be interesting in particular is to note whether there are lessons learned from the extraordinary work that SAMS did throughout the conflict in northern Syria, particularly in Idlib. Things that worked there that are now perhaps being scaled or brought to other parts of Syria as your organization works with others to help with the rehabilitation of the public health sector.
Yes, thank you. Actually, we have a lot of lessons that we learned from our previous experience during the past 14 years. Because as you know, in any conflict, any emergency, the donors and institutional donors are focusing on the life-saving basic services. While in Syria, it is complicated and prolonged crisis. It's a chronic crisis, unfortunately, resulted in mental health disorders for the big percentage, as Diana mentioned, over 30%, but also the neglection of some of the health services resulted in increasing the percentage of the disabilities as well. The trauma and bombing, shelling resulted in disabilities, but also other diseases like the chronic diseases under substandard management of the chronic diseases also results in increasing the disability, lack of the manpower to be productive in the community. So more people are not working. That will and that increase the poverty rate at the country also. Going back to SAMS is a specialized health NGO. We are focusing on health sector with integrating some other sectors, including protection and nutrition. We focused on delivering the basic services, but using the big network of the Syrian American diaspora, the membership of SAMS, which they are over 1,000 now after the liberation. They are over 1,500 members. Using their expertise and contribution is an example for the contribution of the diaspora during the Syrian crisis, which added a lot to the response. So using those resources or unique resources in the Syrian response made us able to create some programs that we were not limiting to the basic and essential health services, rather than building quality programs, investing in the medical education, bypassing some of the gap in the human resources, providing the care at the secondary and tertiary healthcare level. Some examples that we did is that we started very early in the Syrian crisis, since 2014, in our midwifery program that graduated hundreds of midwives, which contributed to the maternal health sector. We invested in the nursing training, and later on we opened some specialized program in the nursing, targeting the mental health program, as it's a big problem in Syria. Also in the physicians, training the physician, we could benefit from the teaching experience and academic background of our members in integrating those experience in the Syrian context. So, for example, for the cancer patients, there's no treatment provided in northern Syria. So we started our oncology program, which remains the main oncology program in northern Syria for years. That was not only focusing on the service provision, but now we have in Idlib 7 oncologists, hematologists. So we trained doctors, which after the liberation, they have been recognized by the Ministry of Health and the local, the Syrian health authorities. So they are a big add to the health sector. Other programs like the cardiology program, the neurology program, and others. So those experience that we had and gained during the Syrian crisis, it's a good source that now are used and beneficial for not only for Idlib, but we are expanding those experience in coordination with the Ministry of Health, Ministry of Higher Education across Syria. So it's not only providing the services, but how to provide the service. What way we have to provide the service. For sure, after the liberation, our response was focusing on the urgent needs, providing medical supplies, medical consumables, based on the recommendation and assessment from the Ministry of Health. But now in the second phase, we are focusing on more sustainable programs. And really, now, as soon as we have more areas to be accessed under a leader in the health governance, so supporting the efforts and the plans of the Ministry of Health, contributing in the planning and in the implementation is the priority. Now, transitioning from the main service providers for the population to the contributor through the national health system is a must and priority. Thank you.
Thank you, Dr. Bachir. And I think this is a good segue, Diana, to bring you back into the conversation. So Dr. Bachir has talked about kind of lessons learned or how they've worked throughout the conflict and then applied that to the work they're doing now. You have also, I think, studied these kinds of challenges in other conflict contexts. So what are some of the lessons learned and observations from your research that might apply to Syria?
Thank you, Mona. Yes, and I think building on what Dr. Bachir has mentioned about Syria being in sort of this transitional phase, so moving from relying almost entirely on emergency support to, more sustainably having a Ministry of Health that meets the needs across the country without and resolving sort of the fragmentation of health systems that he alluded to earlier. And there's a bit of a paradox in what they're trying to do, because in addition to meeting immediate health needs, in the current moment, they also have to lay the groundwork for a more permanent, more sustainable health system. And that's no easy feat. And when you look at other contexts where this has been done, I draw often on post-conflict Liberia, where there was a huge success in terms of how the health minister, after a lot of consultation, including with the diaspora, established a visionary national health plan that really focused on prioritizing primary health care in order to meet these essential needs, to build up the workforce again in terms of training and bringing in training specialists that had left the country. And then donors, in addition, supported with technical assistance and funding across both emergency systems and long-term system building. And in Afghanistan, oddly enough, also has a useful case study, which is regarding a basic package of health services that was prioritized across the country, and also with the support of NGOs that were working closely with the ministry and helped rapidly expand access to care, to immunization, especially in rural areas. But it's a tricky balance to sort of strike, because relying on humanitarian aid in the long term can also hinder the Ministry of Health's efforts to build this more sustainable and locally driven health system. And I can say from my time in Syria that what I recognize was that there's a lot of capacity at the local and, well, let's say at the district level, where already I think colleagues at SAMS and other NGOs have been partnering very closely to really understand what the needs are at the local level, be it in a city or a town, and start to invest in people that are already there, that are already doing good work, but then also funneling attention and resources from donors to these areas. I want to mention, because I draw often on other contexts in the region, which are comparative case studies, but maybe challenges that can be learned from, and Iraq is one of them, just given its similarity to Syria's health system before the conflict there. And despite a lot of international support that came in to support the Iraqi health system in rebuilding, it's never really fully recovered, and access in rural areas remain very limited, and there's an over-reliance on the private sector. And so there are huge fears that could also happen in Syria, where you already see a private sector that's thrived despite the last decade, and if there are inequities that remain across the country, there you will see the private sector become largely relied on by the people who can rely on it, so exacerbating health inequities. I would say I'm looking forward to also hearing from the minister about planned health budget, because that's one of the main ways in which and I think other countries have successfully really prioritized health in a national strategy, and it should account for at least 15% of national budget. So achieving that benchmark would really be a clear signal that health is a priority in Syria's reconstruction, future stability, and the ministry can direct donors to actually support with this and fund projects that strengthen the national system rather than set up more parallel NGO structures. And so this national health strategy would be key to this.
Super helpful. And I think it's a good reminder of the extent to which these challenges, it is truly a transition of moving from emergency life-saving assistance, that's what we see in a conflict situation, to institutionalizing, building out, and ensuring that there are not widespread inequities across the system. And that sort of is a good segue back to you, Lolwa, because I'm curious if you could talk a little bit more about QFFD's work. You noted at the outset the importance of an integrated approach. And I know that Dr. Bachir has started by talking about how fragmented the landscape is in Syria for obvious reasons, because of the impacts of the conflict. But Lolwa, could you tell us a little bit more about how QFFD views the sort of fragmented landscape in Syria when it is seeking to provide an integrated approach? Are you able to operate or provide assistance to projects and programs across the country, expanding, for example, beyond northern Syria, where you all were quite involved prior? And how do you measure success? What are some of the metrics that you are using to determine impact and sustainability?
So since the onset of the Syrian conflict, Qatar was among the first countries to respond. Qatar has pledged yearly between 50 to 100 US dollars million through Brussels conference to Syria to support the Syrian people. Due to access security constraints, particularly in the regime-controlled areas, our focus was primarily been in northwest Syria, and for Syrians in the neighboring countries. In northwest Syria, Qatar Fund for Development has supported various health initiatives. One key project involved the operation of 12 primary healthcare clinics, along with support to the referral system in partnership with Qatar Charity, to ensure that patients in need of advanced care could access appropriate services. These clinics provided essential health services to communities affected by conflict and displacement. We are a funding entity. We typically implement these projects through our Qatari NGOs, Qatar Charity and Qatar Red Crescent, or through our international humanitarian partners to maximize reach and ensure that our impact, our support reaches everyone.
Thank you, Lolwa. And it is helpful. It's kind of helps us to understand the multifaceted elements of how the international community is engaging on this. And that is sort of where I'd like to take the conversation. I'm seeing some interesting questions coming in. Before I get to them, and I think this is a good round to conclude on before we move toward questions, is to look at the role of the international community. It's clear that the Syrian government cannot do this on its own, given the magnitude of the challenge. But Dr. Bachir, can you kind of elaborate a bit on the role of the international community, and in particular, the role of the Syrian diaspora? I mean, you represent a diaspora organization. You've noted the numbers of the Syrian diaspora and their engagement, but maybe elaborate a little bit on how significant the role of the international community is for Syria's successful transition, and in particular for the successful rehabilitation of the public health sector.
Yes. First of all, we are talking now about a country that have experienced a huge destruction. Over 60% of the country is destroyed and destructed. Over 50% of the population fled out of the country. And so far, a very small percentage of the population in the neighboring country went back to Syria. Through our communication, our assessments, regardless of the political situation, political stabilization in the country, the most important three sectors that will encourage the population to return back to their homes are the availability of health, education, and shelter. People can live in a tent, but without having the quality education and schools for their children, and hospitals and health facilities to their families will not go back. So still the health and education are the priority. The international community, in our opinion, should continue supporting the Syria. The government now is starting, it's a fresh government, taking care of a destroyed country with very minimum resources, financial resources, and also human resources. So for sure, we need to continue providing the basic services, the essential services. But most importantly, we do think that the role of the international community, international donor, institutional donor, is to support the health system strengthening. So we need to focus on the health system rather than the health services. We can provide essential health services with the support of international donors, institutional donors, friends, but that will not continue forever. So the sustainability is a must. Supporting the system itself is the priority. This will focus mainly on the health sector, but supporting the health system is not limited to the health sector. We need to invest in the economy and other sectors like the insurance, to make sure that the people have the resources to seek the health services. Partnering with the private sector, which is a very essential component, and also supporting and magnifying the community engagement and participation of the community themselves. So it's a community-led health system. Those are, in our opinion, the most priority. One of the important component is investing in the human capital in the health system. The human resources is very important. That will help for sure. Also focusing on the other national health indicators and sectors, including the infrastructure, availability of the inpatient beds, the accessibility. But in a brief, we should fose on the system more than the services. Thank you.
Thank you. Diana, I'm going to turn to you briefly. You are based in the U.S., in Washington, where we've seen a dramatic shift in the foreign assistance architecture, particularly with the dismantling of USAID. Say a word, if you would, about what role you envision the U.S. playing in Syria's stabilization, particularly in the health sector.
Thank you, Mona. Yes, it's really unfortunate that we're facing this critical recovery moment in Syria and so much momentum on the political front with declining U.S. support and foreign aid more broadly. The U.S. was the leading donor to the humanitarian health response and humanitarian response more broadly in Syria. And right now, globally, only 7% of the $566 million required for the humanitarian response in Syria has been met, and cuts from major donors in the U.S. have put a huge dent in this progress. And we've also seen other countries also, scale back some of their support as well due to donor fatigue, but also this changing landscape. And so we are seeing other donors step in, and it's great to have Lola here to speak to, what Qatar and other countries are doing to support the health system response. But it's essential to, I think, alert donors that, as Dr. Bachir was saying, that health system response shouldn't be an afterthought. It is a core part of stabilizing the country and supporting a political transition that's peaceful and that will ultimately improve the lives of millions of people that remain in high need inside the country. And I think tapping into diaspora networks, which I alluded to in the response about other post-conflict contexts, is essential. This is where you see, the displaced healthcare workforce who's now gone on to other countries and gathered expertise in many different sectors, not only health, play a really important role in sort of bridging the gap in terms of what can be provided and supported on the ground in Syria. And Syrian American Medical Society is one example, as well as some initiatives that I'm a part of myself, including the Revive initiative, which is Syrian American and other allied health professionals from around the world who are hoping to provide our expertise, be it in public health or particular diseases, and health system strengthening more broadly to support the Ministry of Health and sort of this really rough transition in the initial years. And what's really exciting about this is we've honed all this expertise. We have resources, hopefully more that we can tap into in terms of fundraising in order to support now this really vast gap that's emerged as a result of U.S. foreign aid withdrawal in Syria. And also, that sort of community-based and localized-led approach to resolving to health system response, as Dr. Bachir also mentioned, is really having this led by Syrians themselves, those inside the country first and foremost, but then also the diaspora who has a lot of expertise to offer and help build bridges between technical experts abroad and recovery efforts at home.
Thank you. And I think you've pulled on several threads there. I think Lolwa, Lolwa, what we're going to do, we're going to hold, because I believe we have the minister available. So we're gonna take advantage of his availability and proceed with his remarks. I know the audience, because there are several questions that are directed to him, will be very interested in hearing what the Minister of Health has to say. Let me briefly introduce you, Dr. Ali. We are thrilled to have Dr. Musaab Nazzal Al-Ali, Syria's Minister of Health, join us. Dr. Ali has held the post of Minister of Health since March of 2025. He earned his medical degree from Al-Bath University in 2009. He was forced to leave Syria following the uprising in 2011, and had to flee to Germany, where he continued his education and completed his specialization in neurosurgery. Dr. Ali, we're thrilled to have you. We will have Dr. Bachir provide translation, as Dr. Ali will be providing his remarks in Arabic. So with that, Dr. Ali, the floor is yours. Welcome.
دكتور علي حكت مو دكتور مصعب.
دكتور مصعب نزال علي، تفضل سيادة الوزير، كلمة معك. أنا راح أترجم معك إن شاء الله.
خير إن شاء الله. أولا يعني نرحب بكم جميعا ونشكركم على هذه الاستضافة، ويعني الشكر موصول لكل الحاضرين والمتابعين لهذا الايفنت. وبالنسبة بس معلومة صغيرة وردت لفتت نظري، أنا غادرت سوريا بمنتصف العام 2014 وليس في العام 2011.
Okay. Dr. Musaab is welcoming everyone and thanks you to having him in this workshop. Just one correction that Dr. Musaab Al-Ali has to lead the country in mid-2014, not in 2011.
وفيما يخص طبعا القطاع الصحي في سوريا، يعني سأتكلم بلمحة بسيطة عن ما ورثناه من النظام السابق. ورثنا قطاع صحي مدمر على كل المستويات، مستوى الأبنية الصحية، المشافي والمراكز الصحية كانت أكثر من 40% خارجة عن الخدمة. مستوى القطاع الدوائي والصناعات الدوائية في الوقت اللي كانت سوريا قبل الثورة تصدر ل 55 دولة في العالم المنتجات والأدوية، كانت لا تصدر أي منتجات دوائية. انشغل النظام السابق بتصدير منتجات أخرى غير المنتجات الدوائية. على مستوى القوى الصحية العاملة للأسف كان هناك يعني هجرة كبيرة جدا على مستوى القوى الصحية العاملة، ونقص شديد في البلاد في هذا الجانب.
Dr. Musab is talking about brief about the health sector. The Ministry of Health and the government, when they started their assignment, they had destroyed health sector. The buildings were destroyed. The hospitals, health facilities were destroyed. Over 40% of the health infrastructure was destroyed. Also on the pharmaceutical industries, before the Syrian revolution, Syria was exporting medications to more than 55 countries around the world, while during the now it's not exporting any. The previous regime were involved in exporting some other medications. Dr. Musaab was referring to the drugs and other categories. Also, in the for the healthcare workforce, there was a huge depletion and a loss of the healthcare workforce out of Syria.
لا زلنا يعني استلمنا أيضا على مستوى الأتمتة في الوقت اللي تقدم فيه العالم وأصبح يعني يدخل موضوع الذكاء الصناعي في كل المشافي والبيانات. لا زلنا نجمع في مشافينا التحاليل ونتائج التصاوير على الأوراق وبيانات المرضى على الأوراق. وإلى هذا المستوى نحن فيه في موضوع الأتمتة وأتمتة النظام الصحي. في موضوع الحوكمة الوضع كان أنه ولا زلنا طبعا هناك مناطق يعني اللي كان مسيطر عليها النظام السابق، والمناطق اللي كانت في شمال سوريا، وفي أنظمة مختلفة من حيث سلم الرواتب، من حيث آلية العمل. فعندنا أيضا مشكلة في موضوع الحوكمة وموضوع الترصد الوبائي. أيضا لدينا منطقتين، كانت الآن لدينا أكثر من منطقتين على مستوى السيرفيلانس سيستم، على مستوى الترصد، على مستوى متابعة الأمراض. هذا أيضا من المشاكل. وورثنا نظام صحي ليس فيه أي مصدر للتمويل. توجد بعض شركات التأمين الصحي التي لا تؤدي أي غرض من الأغراض المرجوة، وفي مشكلة كبيرة في حتى يعني أمور تتعلق بالفساد في هذه الشبكات. حاولت أنا أتكلم عن أغلب الأعمدة في النظام الصحي، المشاكل اللي إحنا ورثناها.
It's at the time that the world is investing in the artificial intelligence and the digitalization revolution, still we are collecting the information at our facilities on papers. So we are very delayed in the information system. It's paper-based system. In the governance, we have still a huge gap. We have more than one system. There are discrepancies and differences in the between different regions and geographical areas in Syria, between the north and the other areas. That includes the salary scale, the workflow, the procedure itself. Also, in the financing, we have very limited resources. We only have few health insurance company, which they are also ineffective and suffering from the corruption themselves. Dr. Musaab tried to provide and present the challenges following the main pillars of the health system.
بالمجمل كل هذه العوامل يعني أدت إلى فقدان الثقة بين المجتمع، بين الحكومة، فقدان الثقة يعني بين الأشخاص العاملين في القطاع الصحي، يعني بين الشعب بشكل عام. وهذا يعني كان أيضا من التحديات اللي إحنا مضطرين إنه يعني نضيفها إلى التحديات الأساسية، ونشيل كل هاي التحديات نضعها في الرؤية، ونحاول نبدأ بالملفات واحد يعني بشكل طبعا موازي على كل هذه المسارات.
All that factor resulted in decreasing the trust between the population and the authorities and the government. And this is one of the biggest challenges that we are facing, and we are prioritizing building this trust to the population.
أتيحت طبعا بدأنا في يعني أحاول أن أذكر هذه الأعمدة واحد تلو الآخر، ومع ذكر مثال أو حتى إذا كان الأمر واضح لن أذكر أمثلة حتى لا أطيل على حضراتكم. طبعا بدأنا يعني أولى الجولات الدولية بالمشاركة الفاعلة بمؤتمر جنيف. هذه المشاركة أتاحت لنا فرصة اللقاء مع العديد من الدول الصديقة اللي كانت للأسف، طبعا هذه أيضا كانت إحدى المشاكل، كانت هذه الدول في الجانب الثاني لا تتعامل مع الحكومة السورية. وبدأنا بربط شبكة من العلاقات الجيدة مع وزراء الصحة نظرائنا في الدول العربية والدول الصديقة، الدول الأوروبية، وكانت هي الانطلاقة. بعد ذلك على مستوى الأبنية حاولنا أن نحصل طبعا أيضا كشريك استراتيجي على كل المرحلة هي المنظمات العالمية والمنظمات الدولية. بالإضافة لبعض الدول استطعنا أن نبدأ بترميم بعض المباني على مستوى المشافي والمراكز الصحية. وقعنا بعض الاتفاقيات، أو وقعنا حاليا اتفاقية مع الجانب التركي لتشغيل مشفيين كبيرين، واحد في حلب وواحد في دمشق. المنظمات الدولية والمنظمات المحلية تساعد وتساهم أيضا في إعادة تأهيل وتشغيل بعض المراكز الصحية سواء كانت مشافي أو حتى مستوصفات، هذا على مستوى الأبنية.
So our response, I'll try to talk about them pillar by pillar. So our starting point was our contribution in Geneva conference, where we met with many of the ministries of health of the Arabic, European, and other friends countries. Unfortunately, those countries were not dealing with the Syrian government, but we started building this networks with the ministries at those countries. On the infrastructure pillars, we had many agreements with many international organizations and some governments. So now we have some health facilities were renovated through our partnership with international organization and some countries. And we have signed 2 agreements with our friends in Turkey to build 2 hospitals, one in Aleppo and one in Damascus.
استطعنا أيضا يعني في الفترة الماضية، سواء كان على دور الحكومة التي سبقتني مشكورة الجهود اللي قاموا فيها، أو بالوقت اللي أنا استلمت فيه إعادة ترميم موضوع الأجهزة. يعني الأجهزة اللي موجودة في سوريا كان موجود، كانت كلها قديمة. أحدث الأجهزة كانت بالعام 2011 وأغلبها كان يعني خارج الخدمة. راح أعطي مثال واحد فقط اللي هو أجهزة غسيل الكلية. الحاجة الفعلية لأجهزة غسيل الكلية في سوريا تتجاوز 1500 جهاز، بالوقت اللي كان فقط 400 جهاز يعمل بشكل جيد. وهذا الشيء أدى إلى ضغط كبير جدا من ناحيتين، من ناحية الأشخاص اللي يحتاجون لغسيل كلى في البلد، ومن ناحية الأشخاص اللي رجعوا إلى بلدهم وهم بحاجة إلى غسيل للكلى. بالفترة الماضية استطعنا تأمين أكثر من 340 جهاز لغسيل الكلية، دخلناهم في يعني تقريبا إلى الآن تقريبا تضاعف العدد اللي كان موجود عن العدد الحالي، ولا زلنا مستمرين وموعودين ونحاول تأمين العديد من الأجهزة الأخرى. على مستوى منظومة الإسعاف أيضا دخلنا أكثر من 20 سيارة إسعاف جديدة، بعض أجهزة التخدير، بعض أجهزة المخبر. قريبا جدا سيدخل لنا أيضا جهاز رنين مغناطيسي جديد وجهاز طبقي محوري جديد. يعني هذه كلها فقط أمثلة، ولكن لا زلنا إلى الآن نعاني من نقص في مجال الأجهزة، ونحاول أن نجد الحلول بأسرع وقت ممكن.
Other topic of gaps is the medical equipment. The majority of the medical equipment are depreciated. The most recent equipment in Syria and the public sector was purchased in 2011. During the previous few months, either through the current government or the previous government, starting from December to March, they could provide some of the medical equipment. As an example, and for hemodialysis, the actual need in Syria is over than 1,500 hemodialysis machines, while the available machine were about 400. During the last few months, the ministry could provide over than 340 hemodialysis machine that duplicated the number of the machines. The importance of the hemodialysis machine is targeting the current patients who require the dialysis, and also the Syrian returnees who are coming back to the country. Some other examples Dr. Musaab mentioned is getting more than 20 ambulances, MRI, CT scan, and now they have also some anesthetic machines and laboratory equipment. And they are keep trying to provide other medical equipment, but still the gap is very big.
Dr. Bachir, I'm wondering, I don't mean to interrupt, but I would love to make sure we can bring in some of the audience questions for Dr. Musaab. We have about 15 minutes left. So with the minister's permission, I'd like to at least insert a few of these questions that perhaps he can also address in his remarks. We have a question about whether there is a roadmap from the Ministry of Health so that NGOs can align their efforts. We see how important the role of NGOs is in this. And so is there a roadmap for NGOs provided by the Ministry of Health? A second question has to do with the provision of health care and aid to minority communities. We know that Syria has just recently suffered a bout of significant violence in Sueda. It would be useful for the minister to talk a bit about how the Ministry of Health is able to build trust among communities, especially minority communities, and ensure that they're able to get in and provide aid and services there. So let me stop with those two questions. I apologize for jumping in, but I do want our audience to be able to have the chance to have their questions asked. Thank you.
دعني طبعا أبدأ بالسؤال الثاني حول وضع السويداء ووضع الأقليات من وجهة نظر وزارة الصحة. طبعا يعني يبدو أنه الوقت قليل، 15 دقيقة متوفر، فأحاول أختصر قدر الإمكان. أنا كنت حابب أعطي لمحة عن كل الأعمدة، ولكن حأدخل بالجواب السؤال الثاني. طبعا وزارة الصحة أعلنت منذ اليوم الأول أنه هي مهمتها الاهتمام وتقديم الخدمات الطبية للإنسان، وشعارها الإنسان أولاً. لا نسأل عن أي دين أو عرق أو أي جنس في القصة المرضية، وبهذه الأسلوب وبهذه العقلية نتعامل مع كل المواطنين داخل سوريا، المواطنين الزائرين، كل البشر في داخل سوريا نسعى أن نعاملهم ونؤمن احتياجاتهم الصحية على أساس واحد، على أساس العدالة. فيما يخص السويداء لن أدخل في تفاصيل وهي منشورة. المشكلة قديمة بين بعض الأطراف، تطورت، حاولت الدولة والقوى الأمن أن تتدخل لفض النزاع لحل المشكلة. تطور الأمر بشكل دراماتيكي، تدخلت دول أخرى في المنطقة. كوزارة صحة منذ اليوم الثالث جهزنا قافلة أدوية، قافلة أجهزة، مساعدات. بالرغم هذه نقطة جدا جدا مهمة، السويداء ومثلها مثل باقي المحافظات في الأشهر الستة الأولى من العام 2025 مدير الصحة في السويداء يحضر اجتماعاتنا، نتواصل مع كل الطاقم الطبي، هم جزء من البلد. بل بالأرقام ما تم إنفاقه على القطاع الصحي في محافظة السويداء يزيد عن 3 أو 4 محافظات. نحن هنا لسنا بصدد المزايدة من أكثر ومن أقل، ولكن بناء على الاحتياج الذي كان مقدما من السويداء، وزارة الصحة السورية رغم كل النقص أنفقت أموال أكثر من 3 أو 4 محافظات أخرى في سوريا. يعني جهزنا القافلة منذ اليوم الثاني، وأنا شخصيا كنت في المرة الأولى على رأس القافلة بمشاركة وزيرة الشؤون الاجتماعية والعمل. منعنا من الدخول من داخل السويداء، وصلتنا رسائل تحذيرية ورسائل منع من داخل السويداء. رجعنا في المرة الأولى، وبعد يومين جهزنا قافلة أكبر وأشمل، وأيضا أنا و3 وزراء آخرين كنا على رأس القافلة، وحاولنا التنسيق مع عدة جهات للدخول. في المرة الثانية منعنا من الدخول، ولكن أدخلنا القافلة تحت الهلال الأحمر. ومنذ ذلك اليوم إلى الآن يوميا تدخل شحنات منتظمة إلى داخل السويداء. أنا شخصيا على تواصل مع الطاقم الطبي داخل السويداء، تدخل شحنات. طبعا أتكلم عن الصحة، وأيضا أتكلم لأنه شكلنا إحنا غرف طوارئ على مستوى الصحة وغرف طوارئ على مستوى الوزارات الأخرى. شحنات من الوقود تدخل، مواد الغذائية، مواد الاستهلاكية. يتم محاولات حثيثة لإصلاح شبكة الكهرباء، ويتم استهداف العناصر أو الأشخاص العاملين. زميلنا العمارين المسؤول عن الاستجابة الطارئة في محافظة درعا دخل إلى السويداء، وهو إلى الآن مختفي، لا نعلم مصيره. تعرضت سيارات الإسعاف إلى إطلاق نار من داخل السويداء لعدة مرات، وكل هذا الشيء ونحن نحاول وإلى الآن. اليوم كان هناك شحنة جديدة وصلت إلى السويداء. اعذرني دكتور بشير على الإطالة، ولكن هذه إحاطة موجزة عن الوضع.
From the first day, the Ministry of Health committed to a principle that the human first. Every human being in Syria will receive the same health care. Regarding, the Ministry of Health are providing and prioritizing the human being regardless of the religious race or gender. For Al-Suwaida specifically, I said I don't want to go into the details about the conflict itself, but from the second day, the Ministry of Health prepared a convoy of medical supplies, medication, and Dr. Musaab himself was on leading that convoy along with the Minister of Labor and Social Affairs, but they have been prevented from inside Suwaida to go there. And after 2 days, they prepared another shipment or convoy, which is bigger than the first one, along with the 3 ministers. Dr. Musaab and the ministers were not allowed and prevented to go into Suwaida, but they prioritized the population there, and they sent the shipments through the SARC, Syrian Arab Red Crescent. He's at on a daily communication with the medical staff there, but they are prevented to go into Suwaida from inside Suwaida. The government, including the Ministry of Health and other ministries, prepared the emergency response room. They are sending daily shipments of medications, medical equipment, medical supplies, food items, and other assistance. The health, the ambulances in Suwaida have been targeted, and they have been with target from inside Suwaida. They are trying also to provide or renovate the electricity network with huge challenges inside Suwaida. The convoys that the government is sending to Suwaida includes fuel. He mentioned that one of the staff, the head of civil defense in Daraa, who was going to Al-Suwaida, he's disappeared since 10 days, and we know nothing about him. Regarding the spending, during the first 6 months of 2025, the Ministry of Health spent on the health sector in Suwaida what's equal to another 3 to 4 governorates. That because the Ministry of Health is aware about the needs in Al-Suwaida, so they are prioritizing providing the services and resources based on need. He stressed that Ministry of Health and the government are providing services to all the population in Syria equally.
بما يتعلق بالسؤال الأول، وهو رؤية وزارة الصحة أو كيفية التعامل مع المنظمات. طبعا منذ اليوم الأول أنا أعلنتها في خطاب القسم أن رؤية الوزارة للتعامل مع المنظمات المحلية والدولية هي رؤية شراكة استراتيجية، رؤية تكامل، والحصول على الهدف النهائي والأسمى للوزارة، وهو تقديم الخدمات الصحية لكل من يحتاجها. في آخر اجتماع كان للسيكتور كان بحضور العديد من أو أغلبية ممثلي المنظمات المحلية والدولية. كان هناك تقريبا بعض المبادئ التي أطلقناها. المبدأ أن وزارة الصحة تقود وهي تضع الخطط للمراحل القادمة، لأن الوزارة هي الجهة الأكثر قدرة على تحديد الاحتياج بسبب عملها اليومي على الأرض، وكل منظمة أو جهة لديها القدرة على دعم هذه الخطة أو دعم هذه التوجهات فهي مرحب بها. وضعنا أحد المبادئ أن تكون الخدمات المقدمة من المنظمات متكاملة، بحيث أنه كل منظمة تستطيع أن تقدم في الجزء الذي تكون هي فيه أفضل من غيرها، ولا يعني نقبل أن يكون هناك ازدواجية في التقديم، أو سواء كان ازدواجية مكانية كأن تكون هناك منظمتان تدعمان نفس المركز أو نفس الهدف، أو ازدواجية بحيث أنه كل المنظمات تدعم محافظة دون المحافظات الأخرى حتى يتحقق مبدأ العدالة. أكدنا أيضا على أن تكون هذه المشاريع مشاريع ذات نفع. بعض المنظمات تقدم مشاريع ليست أولوية وليست ذات نفع في هذه المرحلة، تستهدف فئة يعني أو تستهدف شيء معين ليس يعني من الأولويات الأساسية. ركزنا أيضا على مبدأ أن تكون هذه المشاريع قابلة للقياس، بحيث أن لا تكون مشاريع يعني فضفاضة كثيرا لا يمكن للوزارة أن تقيس الهدف منها. وأكدنا على مبدأ التشارك، الباب مفتوح لكل المنظمات المحلية والدولية التي ترغب في تقديم أي مساعدة في سوريا وفق المعايير اللي تحددها وزارة الصحة، والتي هي معايير وضعت لتضمن تقديم عدالة، تقديم خدمات لكل أبناء المجتمع. نحن لا نريد من المنظمات أن تتجه كلها إلى مدينة دون أخرى. جميع، ولمسنا هذا بشكل واضح، الجميع يرغب في الوصول إلى دمشق، الجميع يريد أن يقدم الخدمات في دمشق. نحن نؤكد لهم لدينا العديد من المحافظات الأخرى، لدينا العديد من المناطق التي هي بحاجة دعم. نحاول أن نكون ضابط إيقاع لهذه المنظمات بحيث تكون الخدمة الصحية تصل إلى الجميع.
Going back to the first question, the ministry from the first day announced that their relation with the organization NGOs would be partnership and strategic partnership relation and complementarity. The ministry is as the central health authorities, they have the full assessment of the health sector and health needs. They are welcoming any of the organization to provide the services. They will be cooperative with all the organizations, trying to set some principles that have been announced in the last health sector meeting, which have been attended by the majority of the local and international NGOs. Mr. President showed that the principles are the comprehensive services, complementarity, partnership, and equity. So they are trying to organize the work of the organization and support to avoid duplication, and trying to avoid some willingness from organizations. So as an example, he mentioned that many organizations are trying to provide services in Damascus, while in the assessment and in the vision of the ministry, the need is in more than one governorate. It's not also only in Damascus, so they are trying to organize those services, trying to avoid that duplication, like two organizations support the same health facilities or the same location, focusing the fund in one location, ignoring other locations and governorates. Also, he mentioned that the ministry is looking for impactful programs, and the project should be measurable or could be measured clearly to see the impact. But in principle, the ministry will be cooperative and welcoming any contribution from the NGOs towards delivering the health services to the population in Syria.
يعني السامز كانت هنا ورحبنا بهم في المؤتمر وشاركناهم افتتاح المؤتمر. الأطباء من ألمانيا قدموا في حملة شفاء وقدموا في حملة نبضنا واحد وشاركناهم. لدينا العديد من الاتفاقيات، وممكن الأسبوع القادم سنوقع مذكرة جديدة مع منظمة إيطالية ستستهدف مشفى في وسط البلاد.
The ministry welcomed SAMS, and the minister himself thankfully participated in the opening ceremony of SAMS conference early this month. The ministry also welcomed the German physicians who came into two medical missions, Shifa and Nabduna Wahid. Next week, the ministry had signed many agreements with many organizations, and next week they are going to sign an agreement with an Italian organization to support a hospital in the middle region of the country.
So I'm afraid we are about at time. I would love to allow the minister, Dr. Musaab, to make maybe one final comment before we close. And I want to thank you, Dr. Musaab, in advance for making the time to be with us.
طبعا مرة أخرى شكرا، وأحاول أن أختصر قدر الإمكان. سيكون تعليقي الأخير في هذه الحالة حول حقيقة الرؤية التي دائما ننطلق منها وننظر لها، وهي الإنسان أولا. الإنسان أولا، ونقصد هنا الإنسان المريض أولا في عنايتنا، أولا في محاولة أن نقدم له الخدمة الصحية الأمثل. الإنسان أولا، الإنسان الذي هو الطبيب، الذي نحاول أن يعني نرتقي بالوضع التعليمي الطبي، بوضع التدريبات، التمريض، الكوادر الإدارية. طبعا وأنا هنا أستغل الوضع لأوجه رسالة شكر لكل العاملين في القطاع الصحي في سوريا، وكل الداعمين للقطاع الصحي من خارج سوريا على كل المستويات. نقطة هامة جدا، يعني سيكون لدينا أيضا قريبا خلال اليومين أو الثلاث القادمات إعلان حول إصلاح آلية التعليم الطبي في سوريا. ستشمل هذه الرؤية مشاركة واضحة ومشاركة فعلية للزملاء الأطباء السوريين الموجودين في الخارج، وهي دعوة الآن واضحة وصريحة لمشاركتنا بتطوير هذه الرؤية ليكون بالفعل الإنسان أولا. لأنه إحنا إذا كل ما ارتقينا بمستوى التعليم الطبي هذا الشيء سيمنحنا فرصة أفضل للعناية بالمرضى. هل الوضع الصحي الآن في سوريا على كل القطاعات والمستويات هو وضع مرضي بالنسبة لنا؟ الجواب بكل وضوح لا. هل الوضع الصحي في سوريا الآن هو نفس الوضع الذي كان قبل 3 أشهر أو قبل 6 أشهر؟ الجواب بكل وضوح لا. سنستمر بالعمل، سنستمر بتحسين كل القطاعات حتى نصل إلى المستوى الذي نطمح إليه، ونتمنى أن يكون ذلك بمشاركة كل أبناء سوريا، كل كوادر سوريا في الداخل والخارج.
Finally, I would like to assure our vision, human first. Human first means the patient who needs the healthcare will come first in our priorities. The physicians and other health staff who are the service providers are first in our priority list as well, in training them, providing the medical education, medical training to them. The minister would like to take this chance to announce that during the next couple of days, the ministry will announce the plan to restructure the medical education in Syria with the support of the Syrian diaspora as well from outside of the country. And it's a clear and open invitation to all Syrians and all partners to participate in this as well.
Well, with that, I want to again thank Syria's Minister of Health, Dr. Musaab Al-Ali. I also want to thank our terrific panelists for what has been a very rich discussion, and I think just the beginning of a number of conversations we hope to lead on the various elements of Syria's stabilization in this period of fragility as well. I thank all of you. I want to let the audience know that a full transcript of today's event will be available in the coming days. You should also be able to access Diana's publications. I think we included links to those in the YouTube comment box. And with that, I thank everyone for their excellent comments and interventions, and I wish everybody a very pleasant rest of your day or evening. Thank you again.
Thank you very much.